The Democratic Nursing Organization of South Africa is celebrating its 20th anniversary this year. DENOSA is a professional body that represents nurses throughout the country and plays an influential role in setting the standards of healthcare. The organization is agitating for common training standards and the improvement of public health care, and I'm joined to discuss how the organization is doing so far and the challenges it might be faced with and how it is mitigating those challenges. I'm with the president of DENOSA, Simon Hlungwani. Mr. Hlungwani, pleasure to catch up with you again, sir.
You're welcome. Thank you, and greetings to the viewers at home.
And you are joining us for the second time on the show, but I can tell you one thing, as much as I've had interactions with you, sometimes I'm not sure whether you are a union in a straightforward sense, a professional body that is more concerned with the criteria of qualification and the standards of work and so forth. Just demystify or at least clarify this confusion for me.
Okay, the Democratic Nursing Organization of South Africa itself, it's a union and it's a nurses association. In other words, we are having these dual responsibilities. There is none that is higher than the other. We just have to find balance. Worldwide, nurses associations are represented and are registered with the International Council of Nurses. And in South Africa, we're the only organization that is registered at the moment. And we are a union because our members are the ones that are making sure that the organization exists. Over and above that, they have socio-economic needs. As a result, we cannot therefore ignore what they have as employees.
But here's the problem or the challenge, Dr. Hlungwani. People think that when you have unionized nurses, now you have a problem on your hands because they see a correlation between your members being unionized and the standards of healthcare. And they say, you know, since nurses had their own union, standards of healthcare have gone down, and it's because of this union.
In fact, that will be, I can't say it's a fallacy, but I can say it's a misconception or misunderstanding of what is the role of a union in South Africa. Primarily, the union has a key responsibility of ensuring labor peace in the workplace. And that's why it's very important that even nurses must have a representation and a voice at a level where you would have a council, bargaining chambers, and so on. Because if they are aggrieved of particular issues, we need to have a body and a platform to raise the issues without having to go on probably a wildcat strike, things that are not allowed if you are not unionized. Nurses need a voice in the governance of institutions. We need a voice to advocate for what is right to the benefit of the community at large. So if we are not represented and if we are not a union, our voice will be lacking, and it can result into people being aggrieved and maybe downing tools without following a particular procedure.
I will come back to the points you've just made now in a moment, but I want to go back to what happened 20 years ago when DENOSA was formed, because it's from what I gather, an interesting story, an amalgamation of a variety of organizations. Take me back to that time.
Well, in the past, there was, as you will recall, during the apartheid time, we had different homelands. We used to call them homelands. So there were different nurses associations in different homelands. And that included, just to name but a few, there was Gazankulu Nurses Association, Venda Nurses Associations, Transkei Nurses Associations, KwaZulu-Natal Nurses Association. There were many of them, Buputatswana and so on. But there was also another one that was Transvaal, which used to be called South African Nurses Association. The challenge with that is that there was no unity among the voices of nurses. But it was because during the apartheid time, there was different homelands and governance structures that are there. So after the abolishment of the homelands and different defragmentations of the country, we then realized that as nurses, we need to come together, be unified, have one voice and one body that represent nurses of the new South Africa democratically. We need to be, so all the other homelands had to merge and become one. It was a long journey. It took more than 5 years to be realized because it started in 1992 and until 1996, that's when then there was a solid understanding of all the
Now,
homelands.
what's the journey been like so far since 2006 until now?
Well, I can highlight a bit of pointers of what happened. In the past, around 1970s the International Council of Nurses realized that South African nurses through SANA, which was the South African Nurses Association, it was only representing only the white minority. And after realizing that, then they kicked out South Africans from the representation of the international body of nurses. When DENOSA was formed, the first objective that was achieved, in fact, was to re-register South African nurses in the International Council of Nurses, and that happened in 1997, the application, and realized in 1999. It's one of the milestones that we have achieved. Part of what we have also achieved is the development of what we call CSN care for the carer, was to when we started having challenges with HIV and AIDS in South Africa. So we developed and got funding from the Canadian nurses to have a support structure where we would have nurses that are employed to look after the nurses who would be infected and affected by HIV. At that time, it was difficult because it was at a time that the government was not even providing antiretrovirals. But one other thing that we have achieved is to call for government to introduce the chief nursing officer, because we feel we needed a nurse at a level higher that can report to the DG and close to the minister in terms of nursing issues, because you would know that nurses are the majority employees within the healthcare fraternity itself. So we have achieved that, because at the moment we have a chief nursing officer by the name of Dr. Makanya, because of what DENOSA would have advocated for. Something else we have achieved in 2007 was the realization of what we call occupation-specific dispensation, which is OSD. It sought to restructure the salaries of the nurses in South Africa. I know there is challenges in terms of implementation, it differs from one province to the other, but if it was not for us, that could not have been realized. I cannot forget again what we call uniform allowance. I remember we went on the pyjama strike in 2005, where we called on all nurses and said, if you are government and you are telling us we must wear uniform, but you are not giving us uniform. At that time, we were getting 450, and it was called shoe allowance. It could not buy even the shoe.
How much?
450. It could not even buy a shoe.
What, per day or?
Per month, 450 per month, which came out to
Hlungwani,
very
please.
less.
I mean, this is a serious interview, okay?
You'll be
you
be shocked,
occupy a serious position as the president of DENOSA. Was it 450?
It was 450
Yeah.
in 2005, until we said as DENOSA were going on a pyjama strike. Immediately after, the government started giving us, we reached a conclusion and a resolution at the council level. The government started giving nurses 500 rand at that time. It grew through annual increments, yes, and so on. At the moment, it's above 2,000 rand. It is called clothing allowance. That's, yes, what it is. But our realization of uniform should be that there should be provision of uniform, and the uniform that we should wear should be the one that even if you have blood spills on the clothes itself, when you get home and you wash it, it should not have a stain.
Yeah, yeah.
It should be durable. The material must be good, that I can wear it even in winter. I must get a jersey.
But at least those issues have been resolved, right? But
indeed.
But there's another thing that that South Africa suffered along the way. What one may call the brain drain. When a lot of nurses left South Africa, went to the UK, went to the Middle East to go and work there, and so on. What led to that? And given the fact that DENOSA exists now, are you able to attract those nurses back? And has the provision of care by nurses improved in our public hospitals?
Well, primarily was the challenge of remuneration, in that the salaries were so appalling, such that nurses were sort of by the international community, particularly countries like the UK, New Zealand, the US, Middle East, Saudi Arabia, and so on. They are needed a lot because we are best trained in South Africa. That's something that we must take courage and cognizance of. We are best trained in the manner that we experience real exposure. For example, you would have a lot of gunshots, you would have a lot of stab wounds. So you get more practical exposure to that kind of care. And in those countries, they don't have much exposure. We find that one undergoes training but doesn't have
Would
a
not have
chance to
seen.
experience
Yes.
similar.
Yeah.
So when they come to South Africa, but again, the standard itself is so high that we are sought after worldwide. So most people went there because at that time, the salaries were so poor and they needed to make money. And those who went there were able to come home and buy cars, buy
Yeah,
houses.
yeah.
So a lot of people then wanted to go out there.
But-
recently with the OSD, there's been a little bit of a change, particularly in the specialty areas, because the salaries were structured in a manner that you would earn the same salary and whether you work in ICU, whether you have additional qualifications and so on. But at the moment, those who've got additional qualifications, especially in the specialty areas,
Then they
like your
get-
traumas,
they get
ICU,
recognized
theater,
and then,
they get recognized and earn a bit more. I do know that in the general streams, where we have a number of many patients that are there, the salaries are not as yet at a level.
Let me just
to say, let's review the OSD.
Let me interrupt you there then and talk about the training of the nurses. The last time I spoke to you, I'll never forget that story. You said there was a taxi driver or operator who was running a training college for nurses. I'm not sure if that matter has been sorted out now. And question number 2 is the working conditions of nurses, because one nurse now has to look after a certain number of patients, which is substantially more than what used to be in the past. Tell me.
Well, if I were to start with the training itself, at the moment, we're going to have a new framework of training and curricula and development. What is coming out clear is that the private colleges, some of them don't have the capacity. I'm not saying all. Some don't have the capacity to develop the curriculum that will fit in the new framework. And some of them from next year may not be able to continue with their training and the year after. But what I'm saying is that for us to uplift the standard, we must meet the minimum requirements of the curriculum development and so on. But the government colleges and the universities, most of them are ready because they were able to develop the curriculum and so on. There is a bit of improvement. And we are happy with that because at the moment it managed to curb those that were not meeting the standards to be kicked out of the system so that we have those that are meeting the standards. Well, when it comes to the conditions of employment of nurses, we are facing a very huge challenge of shortage of staff at the moment. And with a number of programs that government is committing to make, one is that, as you would know, there is what we call the test and treat. Anyone who is HIV positive, whether your CD4 count is low or more, they will be started on treatment starting from this month. It therefore means it's adding an extra burden of responsibilities on the nurses because primarily in the health clinic, in the clinics that we have, it's nurses who are mending those clinics. And they're going to initiate through the program called NIMART, where nurses initiate the treatment of HIV and AIDS patients. Now, it's adding responsibility, but our country is unable to produce more professional nurses because I need to differentiate. The person who can do and initiate treatment of HIV and AIDS, it's only a professional nurse. So we have the staff nurses and the auxiliary nurses. Those are support nurses. But we have this shortage of this particular cadre of a nurse. And at the moment, the training of nurses in the intake in the colleges is so small that it does not meet the target itself. So you'll find in rural areas, there's a dire need, and such conditions makes it difficult for nurses to perform their job. Sometimes they get, when you are overworked, then you have a risk of getting burnout. You have a risk of making mistakes. And that's what we're saying. It's an appalling situation. Sometimes nurses don't get to go to tea because they realize that if I go to tea, the queue will not move.
Long queues and so on.
It's a problem. But we also have a problem of dilapidated infrastructure. In some areas, it's just difficult for nurses to be able to do an outreach program where you would have to go to the community and do demographics, check how many people have got high blood, how many people have got, for example, diabetes. And you would even know how to visit them, do home visits, go to schools and do assessment of schools. You need to make sure that the kids that are in schools do not have eye problems, they don't have vision problems, let me say. They don't have problems with speech or even the physical bodies themselves.
Dr. Hlungwani, I think because the issues are many,
Yes.
and of course it's an ongoing discussion, we're going to call you or your colleagues back to the program to discuss some of these things, including the Department of Health and the private health sector. I haven't even touched it, and there are issues there as well.
Yeah.
But we thank you for coming around and spending time with us here. DENOSA is 20 years this year, and we'll be celebrating it on the 5th of December this year, that anniversary that we mentioned earlier on. The challenges are many, the topics varied, and you, as somebody who now and again visits clinics and hospitals, you've got your own questions, most definitely. So next time around,
Yeah.
we will be taking our viewers' questions as well.
Yeah, and shall I mention this one? There's a huge challenge of government in provinces, that not all provinces have got chief nursing officers, and we want them to employ there. Now we have serious challenges again with regard to community service nurses. Those who have done the 4-year diploma,
Sure.
they do community service for a year. They need to be appointed the following year, and they are needed in the provinces. But some provinces, like in KZN, I hear them say, no, they will not automatically employ them. In Free State, they are given trouble when they have to employ them. They say they don't have money. Now, I'm saying this because I think our government must wake up and shake itself up. We need those nurses. The community needs them. The beneficiary is not nurses, but the community that will be receiving services.
Samuel Hlungwani, thank you very much.
Welcome.